Every day, paramedics are faced with the task of time-critical and strenuous situations with the patients that they treat. At times, associated with the clinical skills and effective communication required, paramedics can also be confronted with bioethical dilemmas. When time is crucial and patient outcome paramount, it is essential for the correct decisions to be made to ensure the welfare, safety and respect of all involved remains intact. The following video will demonstrate a typical scene that paramedics may be faced with, incorporating a bioethical dilemma, which will be followed by further discussion on one ethical theory and the 4 bioethical principles.
Paramedics have been called to the house of a 10-year-old female who has a suspected fractured arm.
G'day guys, come in.
Hi, I'm Taleisha and this is Fraser from the ambulance.
Nice to meet you. My name's Rhys. My daughter Sarah, just sitting over here. She's just taken a fall in the backyard today and she said she's in quite a bit of pain.
Okay.
That's the reason I called.
Hi Sarah, I'm Taleisha and this is Fraser. Can you tell me what's happened today?
I was playing in the backyard and I fell on my arm.
You fell on your arm. Are you in quite a bit of pain?
It really hurt.
Yeah, what would you give it out of 10? 10 being the worst pain you can imagine.
Like a 9. It was really bad.
A 39. Alright, so we've got a few things that we can do to help your arm here. Dad, this is to you too. So we can put it in a splint for you, so we'll get to that a bit later. But at the moment we can give you some medication, some pain relief, just to take the pain away so we can move and stuff.
What? Pain relief? What do you mean? What are you going to give her?
Yeah, look mate, she looks a bit distressed. I think the pain relief will just calm her down a little bit. You know, she looks a bit anxious at the moment.
Yeah, mate, like the splint I'm happy with, but mate, our family's got a no drugs policy, mate, whether they're good or bad. So no, the reason I called you, mate, wasn't for pain relief. She needs to get in the car and go to hospital. Okay? So no questions asked, no pain relief.
Autonomy in healthcare is based on the principle that the patient has the right to make their own decisions regarding their treatment and management based on their own values and morals. Within this presented case, there are conflicting views of individual autonomy. Firstly, the father's autonomous beliefs of not wanting his child to be given pain relief must be considered. As the daughter's legal guardian, he has the legal authority to decide the level of medical attention she receives. If paramedics were to respect the father's autonomy, no pain relief would be administered to the child, leaving her in serious pain. On the other hand, paramedics must assess the child's level of autonomy as she is only 10 years old. She is capable of demonstrating her autonomous right to seek medical help, as she knows that the administration of pain relief will ease her current pain and suffering. If paramedics disregard the father's autonomous views and give the child pain relief, then they are respecting the autonomous belief of the patient, however, causing considerable negative implications on the father's beliefs. Therefore, when it comes to paramedic management of a child who is in severe pain, paramedics face the confronting issue of dealing both with the parent's autonomy as well as the autonomy of the child. The chosen outcome must be based on the best intentions for the child, which then leads to the basis of the next bioethical issue, beneficence.
Beneficence is based around the moral obligation for actions to benefit the patient, particularly within the healthcare setting and public health programs. However, this principle does have limitations, including the amount of risk a doctor or paramedic should be obliging to take when treating a patient in their care. Beneficence must also be combined with other factors, a major one being the right for an independent patient to refuse or decline the treatment options available to them. Although these treatments may be in their best interests, the autonomous decision of the individual overrules beneficence in these cases. For our paramedics in this particular scenario, it would appear obvious for them to oblige to the daughter's needs for pain relief, being completely against her father's wishes. A decision would need to be made in relation to whose autonomous decision overrules the other, and again questioning how much risk that health professionals are willing to take to obtain the best possible outcome for all involved. There also remains to be a conflict of interest in relation to both beneficence and non-maleficence, this being the reality that in the process of patient treatment some harm may occur, such as cannulation or the realignment of a broken bone to aid in the healing process. However, in the end, Beneficence defines the intentions and procedures offered by healthcare professionals to be in the patient's best interests, and the personal decision of that individual should overrule all others to allow their decisions to be respected and adhered by.
The principles of non-maleficence counterbalances beneficence with the aim to do no harm to patients. Harm to patients can occur with some forms of medical interventions, whether the intervention is beneficial to a patient or not. The term harm, in the context of this case, can come from multiple aspects. The mental harm that could be caused by disregarding the parent's decisions to refuse treatment, the undue harm that can be caused from leaving the patient in pain without giving medical treatment, or the undue harm caused by medical intervention, such as cannulation. When disregarding the parental decision, it could cause further harm to the parent by inducing stress or anxiety due to not abiding by their particular beliefs and morals which form their decision. However, this may be justified by relieving the undue harm to the child if no analgesia is given. On the other hand, by following the parent's decisions, further undue harm could occur to the patient by not administering the analgesia which is readily available from paramedics. Depending on the type of pain relief to be administered, undue harm may occur due to the necessary medical intervention techniques, as mentioned before, such as cannulation or muscular injections. This may cause temporary pain, however the harm would be justified as it is aimed at providing pain relief which fulfills the healthcare worker's role. Although a potentially harmful intervention may be used, the benefits of decreasing or stopping the pain outweigh the harm of the medical intervention. The principle of non-maleficence can be used by paramedics to aid their decision about whether or not to administer treatment.
Perhaps the most difficult of the four principles to define, justice is a bioethical principle intended to assure fairness within the healthcare system. Justice can be used to refer to non-discriminatory treatment of an individual or can refer to the fair allocation of healthcare resources at a community level. The main points of justice and the related ethical conflicts within this scenario include treating others respectively. Paramedics are faced with the challenge of deciding which individual's wishes to respect in this situation. The child has clear desires for pain relief as she is experiencing severe pain. The father has strong views against pain relief drugs and his wishes are for no pain relief to be administered. Managing all patients the same. Justice in this scenario may relate to the fair treatment and respect of the parents' views despite the fact that they are not typical. In relation to patient treatment, treating all patients the same in this example will be an issue due to the fact that in the same scenario, almost all other children would have parents who are for the administration of pain relief, and therefore that is how the child would be managed. Doing what is right and fair. Ethically, deciding to do the right and fair thing for the child would result in following her wishes and giving pain relief. This, however, would ultimately be disrespecting the wishes of the father, which would go against the ethics of justice. On the other hand, respecting the father's wishes, while being fair to his authority and opinions, ultimately leaves the child in severe pain, which is not a fair outcome for her. Justice may play a much bigger role in such a situation if factors were to come into play that may allow for discrimination or judgment leading to a different or lesser level of management.
The bioethical theory of consequentialism looks at the end justifying the means and doing the greatest amount of good for the greatest amount of people. John Stuart Mill and Jeremy Bentham, both key philosophers in the development of this theory, both believe that pain and suffering is bad and anything that promotes happiness is good. A predecessor to this theory, Henry Sedgwick, stated the conduct which under any given circumstance is objectively right is that which will produce the greatest amount of happiness on the whole. In the case presented, if paramedics abide by the father's wishes and do not administer pain relief to the daughter, whilst they have promoted his happiness, the daughter is still in pain, which is not the concept of this theory. Consequentialism is also used as a means of overriding a patient or parent's decision if the medical professionals have the patient's best intentions at heart. Therefore, in this circumstance, because the father's intentions were preventing his daughter from being provided adequate care, his decision can be overridden if paramedics deem drug therapy necessary to end pain and suffering. Therefore, in relation to the theory, the father withholding pain relief from his daughter is considered bad, as it does not promote happiness for the individual involved. The administration of pain relief to the daughter would eliminate her pain and suffering and therefore promote happiness, which supports the concept implied by both Mill and Bentham. Sedgwick's statement is also supported, as the conduct of the paramedics administering pain relief in this circumstance is producing the greatest amount of happiness for the individual involved.